Also staffing this committee, and we're happy to have them both to join us and to be providing the kind of contributions that are going to be important. So keep up the good work. With that, I guess we don't have enough. No. Okay, so we will operate as a subcommittee, and I will.
Take Huff first.
Who's up?
Sir. Take Huff first.
Good. Okay, is Huff here? Huff's here. Mr. Minority Leader? Mr. Minority Leader, the floor is yours.
Oh, so soon I'm given something.
Well, that's what friends are for. Senate Bill 352. Oh, we do have a quorum. Madam Secretary, please call the roll.
Price.
Here.
Emerson. Here. Corbett. Correa. Hernandez. Negretti McLeod. Vargas. Walters. Wyland. Where'd Correa go? Got to come in. Vote just hit him.
He dipped out to be good.
Yeah, he has to be here to say it. He left.
Okay, we've got a quorum?
No.
We don't have a quorum.
Correa left.
We're waiting for Mr. Correa. All right, well,
I didn't hear him say it. Did he?
It's walked.
Did he say it? He poked his head in. I guess we can count that as.
Yeah, let's count
okay.
it. I think it's.
We have a quorum.
We have a quorum.
No.
Okay, item 2. Senator Huff.
Yes. Thank you, Mr. Chair. I bring before you today SB 352. Over a year ago, I became aware of an issue that there were some chiropractors using laser to treat food allergies. Having some awareness of food allergies through former colleague Dennis Hollingsworth, as well as my own staff. This seemed like a significant issue, so I did some inquiry and approached the Board of Chiropractic Examiners with my concerns regarding their involvement in the diagnosis and treatment of what can be life-threatening allergies. And while allergies can be a nuisance in some instances, actually in practically every instance, in others they can be dangerous and life-threatening if not handled properly. So if a person who's allergic to nuts, for example, were to eat them, the outcome can be fatal. The Board was open to looking into regulations. That was about a year ago. To date, there are no approved regulations, and I've been trying to understand the process a little bit more, and I understand it does take time, but it seems like it's taking longer than it should be, and that, again, may just be part of the time, but I'm up against a deadline on my bill, so that's why I'm here today, just to move it forward to the next step. With a health issue as serious as this, I believe we need to be proactive and not reactionary. So I'm moving this in an effort to bring resolution to what I believe may be a dangerous issue that doesn't seem to have regulation. SB 352 states that chiropractors are prohibited from engaging in the act of treating and diagnosing patients with a hypersensitivity to allergies. This measure also prohibits them from advertising they can do these things. Finally, it gives the board disciplinary rights should their licensees choose not to follow the law. The FDA and the California Department of Public Health have been engaged in this issue and are pursuing the manufacturers of many of the devices. I have witnesses here today in support of the bill, starting with one of the leading physicians in our state on allergies, Dr. Travis Miller. And after Dr. Miller, we'll move on to Dina Robertson, who has a personal family experience with the treatment.
Thank you.
Thank you, Senators, for being here. As Senator Huff said, my name is Travis Miller. I am a board-certified physician and licensed by the state of California. I practice allergy and immunology in the Sacramento area. I'm also board-certified in pediatrics and internal medicine. At the same time, I was approached by many patients of mine who have allergies who had been asking me if they should take the advice of a chiropractor who they had come in contact with regarding laser treatment for their allergies, and I made it very clear to the patients who were in fact asked me that question that I thought that was not a good idea, as allergies can be life-threatening. There's 50 million people in the United States with allergies. There's probably 12 million with food allergies. There's 5,000 allergists. I don't expect that all patients with allergies will get care from a specialist, but nevertheless, it can be a potentially extremely dangerous issue. I wanted to bring some examples of food allergies And this is a patient who's given me written consent to be able to distribute his information. He has life-threatening food allergies, as you'll see. He was actually approached as well, and in discussion we agreed that he not go down this road. For the group of the senators here, I just wanted to define what's the difference between an intolerance and an allergy. I took my definitions from Wikipedia. Intolerance are negative reactions, often delayed, to foods, beverages, additives, or compounds that may produce unwanted symptoms. They might include bloating, cramping, belching, nausea, gas, diarrhea, constipation, or rash. That was one of the discussions that I've read from the groups who oppose this measure, is that this would not allow them to diagnose. Intolerance is quite the opposite. Intolerances and allergies are very different. Allergies are hardwired immunologic responses to environmental or food substances we call allergens. They're inflammatory, and they can range from uncomfortable to life-threatening, as we've said. I've never read anything to date to suggest that lasers have anything to do with either the diagnosis or treatment of food allergies, and I read a lot of literature regarding allergies. The next thing I wanted to share with you is actually our federal government spent money to establish the diagnosis and treatment of food allergies and actually published those in December of 2010. These are guidelines which I think are fairly concise, and I'll draw your attention to the fact that diagnosis has nothing to do with lasers. In fact, blood testing and skin testing are the only methods by which they endorse, in addition to a food challenge. Once a patient has been diagnosed with food allergies, avoidance is the primary measure of treatment at current time. They can have things such as epinephrine should they have life-threatening symptoms. We give them anaphylaxis action plans, but unfortunately there is no definitive treatment at current time. So I believe that chiropractors have an important role in treating our mutual patients. However, I think that when it comes to allergies and potentially life-threatening food allergies, there lacks not only a scientific background for the use of this therapy, but it also violates the Hippocratic Oath, which I took specifically, which discusses non-maleficence or do no harm. And that's why I'm here today. I want to thank you for your attention, and if you have any questions, I'd be happy to answer them for you at the end.
Any other witnesses in support?
My name is Dina Robertson. Thank you very much for having me here today to share my story, and I appreciate Senator Huff and your support on this issue as well. I have two small children who both have severe allergies. I also have the history of losing a sister to an asthma attack, and so I realize very clearly that sometimes you can get to a certain point where nothing more can be done to save someone, and I live with that fear every day with my own children because Haley, my oldest, does have asthma, and my youngest daughter, Abby, does have a nut allergy. And if Abby were to ingest a nut, she would be in risk of having an anaphylactic reaction. I was given a flyer advertising the local chiropractor, the services for the laser allergy, and on September 2010, I did take my oldest daughter, Haley, in to be treated, and we went approximately 8 times. We were told anecdotally about patients that would have one treatment that were severely allergic to animals that then were able to go up to an animal, vigorously pet the cat, rub it on its face, and would have virtually no reaction. So after my daughter was treated for cat and dog hair, we went to a friend's house. My daughter did pet a cat, and she began to develop severe reaction with her allergies and her asthma. So we immediately gave her her pill, her inhaler, her nasal spray, had her take a hot shower, and she was able to recover from that. We did let the chiropractor as well as Dr. Miller know what had happened, and I let them know also that the reaction almost seemed to be more severe than it had in the past. They did refund my money at that point, but they did ask to continue providing the service because they were confident that it would still work. Prior to this event, I had also taken in my youngest daughter, Abby, to undergo treatments for her nut allergies. And I brought in actual nuts, cashews, walnuts, pecans, almonds. And it was explained to me that the laser would work in conjunction with these and that it would recondition her body to not react inappropriately if she were to ingest the allergen. I was surprised at that point that she was basically free to go and walk out of the office and be able to eat a nut. And I did share with them that from my history and the fear for my own daughter, that if someone were to experience an anaphylactic reaction, that they could get to that point where there is no saving them. And that is why the majority of food challenges are instructed to be done right outside of the doors of an emergency room. And I still was not instructed to do so. So I was already hesitant to the process. I was very conservative for the sake of my own daughter's health. And my goal in the treatment was never to suddenly be able to have Abby have a peanut butter and jelly sandwich, but instead that if she were to accidentally be in a situation and ingest a nut, that perhaps best the reaction would be less severe and we would have more time to save her. So on a trip to Monterey, we had a frightening experience on New Year's Day, 2011. Abby wanted a bite of a See's candy, and so my husband opened it up, saw visibly that there was not a nut, but did not read the ingredients to see that it did contain almond oil in the chocolate. So Abby took a little bite, she spit it out, and she began to have an anaphylactic reaction right in front of our eyes, which means that her face began to develop hives, she began to swell, her lips began to swell, and her right eye began to swell and disfigure as well. And she became very lethargic, which are all very common reactions to ingesting an allergen. We rushed her to the emergency room, which luckily was right down the street from where our home is, and they took one look, they rushed her in and admitted her immediately, where she was given an IV. And when the doctor asked me, does Abby's voice sound like it's getting higher, I knew that that was the way they were asking to know, because her throat was beginning to shut at that point. So they put an emergency rush onto the medicine. They were able to get the medicine to the emergency room, stop the reaction, and after hours of observance at the emergency room, we were able to head home. I alerted the chiropractor's office to what had happened so that they would be aware and that hopefully no other children or their patients would be affected by this. For this reason, I'm in strong support of SB 352. I'm very concerned that patients with children that have allergies and food allergies are a group that does look for some kind of help, and if they go out and find this, they may not be as conservative and skeptical as I was, and that their children or themselves are currently at risk. Thank you so much.
Thank you. Any other witnesses in support? Come right up. Let's make room.
Ryan Spencer with the California Medical Association. Just like to thank the senator for his leadership in this particular issue, dealing with life-threatening diseases such as food allergies and allergies to medications, bee stings, and whatnot. Also for the reasons stated by the previous speakers, California Medical Association in support of this measure.
Other witnesses in support? Any witnesses in opposition? Can we make some room at the table, please? We've got a little opposition.
Good afternoon, honorable senators. Is this on now?
You're okay.
I'm Dr. Fred Lerner, D.C. I'm chair of the Board of Chiropractic Examiners. I'd like to say, starting off, that we also share the same concern about our licensees treating anaphylactic reactions with food allergies. The only difference here is we've been promulgating a regulation on this for about the past year, and we've been working very diligently with Senator Huff's office. We've spent about a year listening to stakeholders, but these things do take time, and some things we can't change about that. We voted our final language in at our last board meeting. We have to give a 45-day notice to go to a public hearing, which should take place in March. At that point, we have to give a 45-day hearing period for opposition. We then have about a month to prepare the regulation. It goes to the Office of Administrative Law, and they have another month. And there's just nothing we can do about speeding that up. There are some aspects of this bill language that gives us great concern. One is by limiting or removing our ability to diagnose conditions. It jeopardizes consumers. We also have concerns about the necessity because we already have several regulations in place that could regulate this, and we have actually disciplined several chiropractors who have created those advertisements that the senator was first concerned about. So we're doing everything we absolutely can, and as quickly as we can. We anticipate we'll have our regulations done probably within about a 6-month period if my timeline is correct.
Okay. Other witnesses, please.
Good afternoon. I'm Dr. Cassie Donahue with the California Chiropractic Association. We are also opposed to this bill. Our scope of practice right now requires that we differentially diagnose every condition in the body so that we can appropriately refer those patients that should be referred, co-manage those that should be co-managed, and treat the ones that we can treat individually in our office. One of the things that is our biggest concern with limiting our ability to diagnose is that takes away our ability to appropriately refer. A number of our patients that come in to see us do so because they choose not to take a medical route with regard to treatment of their condition. And just as an example, if I have a mother bring in their child who's complaining of neck pain and headaches and has itchy, watery eyes, right now I can differentially diagnose that child as perhaps having some sort of environmental allergen and would refer them to their allergist. If that mother, though, chooses not to take that route, at this time I would do a trial of treatment, see if the child responded, and if the allergens, the itchy, watery eyes continued, then I would again refer that patient out to see their appropriate medical doctor. Not being able to diagnose that condition would really cause public safety issues because I wouldn't be able to appropriately refer the patient.
Other witnesses in opposition, please.
Good afternoon. Thank you for being here this afternoon. My name is Dr. Howard Mays. I've worked with 2 of the chiropractic colleges. I work on staff as clinical staff with the USC University Park Health Center. To this point, none of our students, interns, none of our classes are allowed to use any modalities that have not been taught in our classrooms. Every one of the therapies that we use, including laser therapy, the students, the interns, the chiropractors who are using them, they understand how they're used, why they're used, and the physiologic effect. And to this point, I've never seen anything that's been any negative reactions to this. So I'm highly opposed to this bill.
Okay. Any other witnesses in opposition? Members, any comments? Senator Corbett and Senator Hernandez.
Yes, I'm sorry that I did step in a little bit late and didn't get all of your testimony, but I was interested in knowing, I understand, you did say that you have been working for about a year on these regulations. Help me understand the process. A year seems a little long, but if you could help me understand the process, maybe that will be helpful. And if you could also sort of give the committee an idea as to how much time you think you still need to continue to move forward on this on a regulatory basis.
I think you'll find, Senator, most regulations take about 3 years on the average to vet through the process. We hear a lot of testimony from different stakeholders on issues. We may or may not agree with them, just like you. And we look at the danger to the public, of course, because that's our primary reason for being, is to protect the public. I do need to point out to you, we've never had a single complaint filed with the board for treatment of lasers or treatment of allergies, and as far as we know, in its existence. But we do take things very seriously. We certainly took Senator Huff's concerns seriously, and we meet about every 2 months as a board. I don't think we could meet much more often than that, just because of the cost of the state and other concerns. And we've spent hours and hours on this, trying to vet and clarify the language so that we wouldn't have opposition at the back end. We find that it actually works more expediently to get this out of the way first, and once we send it to OAL, often it's just a 30-day approval period, sometimes even less. And so we try to clean things up on the front end rather than wait till everybody files complaints and then we have to start all over again. What that looks like is after the initial 45-day comment period, we have to go back, amend the language at a board meeting, and then send it out for another 15-day comment period. and another 15-day comment period, and it just keeps going like this until we get a regulation done. So to avoid that, we held this up front in the first place. As far as what's left, I described that we voted the final language in at our last board meeting in November. It requires a 45-day notice, which will take us to March to have a public hearing, which we have to do. Once the public hearing is convened, we go through the 45-day comment period where anyone in opposition to the regulation can send in written or verbal complaints. We then meet as a board again to see if we have to address the opposition. If there's none, which I don't think there will be at this point, then our office takes about roughly 30 days to put the regulation package together with all the reasons for the regulation, and we submit it off to the Office of Administrative Law. From there, they have 30 business days to accept the regulation or send it back. So if you add that up, 45 days, 3 months, 4 months, about 5 to 6 months more, and this should be done. And we're just asking to be allowed to continue with our task. I think we're moving very well. This will be about 1.5 years to get a reg through, which you may not be used to taking this long. I understand that in the legislature, but
Oh,
for
no, we
us,
take our time sometimes, too.
Okay. Well, for us, that's pretty high speed.
Please don't get misinformed about that.
Much faster than the 405 anyway. So.
But you think another 5 to 6 months?
It would have to be that way, no matter how quickly we wanted to move on this.
So that would be after we conclude our legislative session this year, or before?
I don't know the answer to that, but okay.
Okay. Yes, hopefully before. That would be very helpful, I think, if it happens before we conclude our session. Right. Thank you.
Senator Hernandez.
Yes, thank you very much. And you're the president of the board?
The chair, yes.
The chair. Are you a chiropractor as well?
Yes, sir.
Okay. You had made a comment about the effects that this particular bill would have on your ability to diagnose. Can you kind of explain to me what your comment?
Well, it's the language of the bill, where you're limiting our ability to diagnose food allergies. Well, you aren't. I mean, the bill does. And
so that currently is in the chiropractic statute or the...
No, that's in SB 352.
No, but if you're limiting your ability to diagnose, I'm assuming, is in your act. Is that correct?
Yes.
But my understanding, correct me if I'm wrong, wasn't that an act of the people?
Yes, sir.
So in order for us to do that, don't we have to have the vote of the people to eliminate what you can do as far as your diagnosis?
Yes.
So I'm just raising the question because that was your concern about the elimination of the diagnosis portion.
Well, we believe this has to go out to, if this makes it through the legislature and the governor signs it, there would then have to be a proposition to the people who would have to vote on it. So we'd have to open up the Initiative Act and make this sort of change.
And I'm not real familiar with your law, with your act, and that's why I was just curious. I do know that the Chiropractic Act was an act of the people. So this bill would alter your Chiropractic Act, correct?
Yes, potentially.
By not allowing one. So according to the Act, at this point, can a chiropractor diagnose allergies?
Yes.
Okay.
Senator Huff, you want to clarify?
On that point, in the testimony raised a good issue. I'm willing to take out the restriction on diagnosis. I think that is a valuable part that they could contribute in. So I have no problem with striking that. As far as the legality of it, you make a good point.
And that was just my question, because I know he had a concern, and I'll be honest with you, I hadn't read, and Senator Alquist just pointed out to me, and I mean, I'm sorry.
It's okay. Our first names will start with that.
I'm sorry.
More nuts for you.
It's been a long break.
It hasn't been a long day. It just started. But it just struck me that even if this law were to be signed by the governor, because it's an act of the people, I don't know if we can do that.
And Ledge Council was inconclusive in how they looked at it. They thought there may be some merit there, but it's probably something that would get taken care of in the courts who would ultimately decide. Scope of chiropractic and medicine has changed quite a bit since the original time. But just for clarity, I'm not trying to prevent them from diagnosing, and I'm willing to take
And that's what my concern about is this particular bill. And I understand that the scope of all the practices have changed, but the big difference between medicine, dentistry, optometry, is that they're through the will of the legislature as opposed to chiropractors is through the will of the people. So that's my biggest concern for this particular piece of legislation. I don't know if the lasers are an appropriate form of treatment. My concern is that this piece of legislation is going to change the act, which I don't know if we have the ability to do so. That's just my question that I'm raising.
Okay, good question. Senator Emerson.
Dr. Lerner, as chair of the board, can you cite specific scientific articles stating that laser is an effective treatment for allergy treatments?
No, sir. We've investigated this pretty thoroughly, and we're convinced that you can't treat allergies with lasers. We don't disagree with Senator Huff on that at all. We haven't seen a shred of evidence. I agree with the previous doctor's testimony about that. We certainly don't want to advocate that as a board, and we've actually disciplined people for those ads. We've managed to get, I think, all those ads or most of them pulled. So I think we've done some good there. No, as far as we know, the only use of lasers is treatment of chronic and acute musculoskeletal pain. And these aren't the lasers that burn people. I don't want to get into a whole technical things, but we're just talking about what we would call a low-level laser, a cold laser, that is good for acute and chronic musculoskeletal pain. That's what the FDA does, accept it for, and that's what we would be limiting the scope to with this regulation that we have.
Because I do have concerns as a healthcare provider that if a modality is being used, and that there should be some pathway for discussion about that, and in protecting the health and safety of patients, that we should not be in any way not disciplining or eliminating that treatment modality.
Well, in our opinion, claiming that sort of thing violates truth in advertising laws as well. So we already have the ability to discipline our licensees for that.
Thank you.
Any other discussion? Senator Corbett?
I have a question for Senator Huff, and Senator Hernandez and I were having a little sidebar here. There's conflicting issues raised by this measure. One is, is the regulatory process the more appropriate forum for taking a look at this issue? The other is this whole issue of what authority the legislature has when a profession is provided, where the rules for a particular profession reside in an act by the people. And that is a little disconcerting as well. And then there's just the issue of making sure that an issue of concern is addressed, which Senator Huff has very appropriately raised. And I guess a question I would have is, Senator Huff, if you do see that there is going to be, this issue will be addressed in a regulatory way before the end of session, would you be willing to, appropriately hold the bill or, take notice of the work that's being done? So I'm having the same confusion and conflict with regard to whether it's appropriate for us to deal with this issue and because of the act, because of the unique circumstances of chiropractic and how they're authorized. But also I certainly understand, Senator Huff, what you are trying to do to ensure that the regulatory process does work and does move along and does address this issue, which I believe the board is also very sincerely concerned about as well. So,
right, and thank you for the question. The short answer is yes, I will pull it back. What we're up against is a legislative deadline, and to be fair, they have been working cooperatively. The timeline, I've expressed the same frustration you did, you originally articulated, and I don't know how much is process versus just inertia. But nevertheless, if we can get this through, I'll totally drop the bill, because it was always just to make sure, the best is that it's self-monitored and that, it takes care of it without legislative action. Because there is a legal question. Senator Hernandez brings up a good question, and it's possible that is something that would be decided in the courts should it go forward. For my part, if you have chiropractors, and I will say that I'll call them rogue chiropractors because I don't think it represents the nucleus of the industry. I certainly have benefited and am a constant user of chiropractors. But to treat potentially life-threatening allergies with a treatment that has no scientific base, and in fact has, as we had some testimony here today, has just the opposite, where you have a false sense of security, and then you should ingest some nuts and go into anaphylactic shock, that could exacerbate a problem if you have somebody that hasn't been disclosed that this may or may not help, and they feel that it has. And that's really what's driving this. And so they're working well. I think they'll get it taken care of. I'm willing to take out the diagnosis right now because that's a very legitimate question that's been raised. But if the committee could just move to the step forward, and if they get it done in 6 months, this pulls back, and we have the regulations in place.
Okay, well, it's clear we are moving on two tracks, obviously the legislation and the regulatory approach. And in an effort to address the issue, I think in overriding it is the potential legal challenge as it moves forward. There is a recommendation that it move forward to PROPES and hopefully continue this discussion as it progresses. Madam Secretary, read the roll. Is there a motion? Is there a motion?
Was there an amendment?
Yeah, I would do it as amended to strike the, in fact, to be specific, it's listed on page 2, line 20, where it reads, the practice of chiropractic does not include the treatment and strike or diagnosis. So it just wouldn't allow the treatment of hypersensitivity to foods, medications, and so on. Okay.
All right, so it's move to pass as amended.
Due to the timelines.
Due to the timelines, we'll need to have the amendment done in Appropriations Committee.
Okay. All right, so we'll just, as is here.
Refer to.
Okay. Okay, Madam Secretary, please call the roll.
Price?
Aye.
Price? Aye. Emerson? Emerson, aye. Corbett? Corbett, aye. Correa? Hernandez? Negrete McLeod? Negrete McLeod, aye. Vargas? Vargas, aye. Walters? Walters, aye. Wyland. That's 6-0 right now.
Okay, 6-0. That bill is, we'll hold it for one more vote.
Yep.
We'll hold it.
Next one is Padilla.
Senator Padilla, next up. 694.
She's on the committee.
Oh. Good. Senator, you may proceed.
Thank you very much. Good afternoon, Mr. Chairman, members of the committee. This is SB 694, which I've introduced in an effort to improve dental health access in California, especially for children. Both nationally as well as in California, tooth decay ranks as the most common chronic disease and unmet health care need for children. And poor dental health, as too many families know, can disrupt normal childhood development, impact the child's overall health, and adversariously impact a child's ability to learn. Just some statistics for context. In 2007, there were more than 83,000 Californians who visited the emergency room for dental problems. Not only is that a big number, it's an expensive number. It costs the state more than $55 million to provide such care in an emergency room setting. In 2007, that same year, California children missed 874,000 school days due to dental problems. So the toothache isn't just an excuse to get out of a test. It is real. And it's costing school districts at the local level more than $30 million in school-based funding based on average daily attendance. So people naturally ask, so what are the barriers for proper dental care access? There's a series of factors, as you can imagine, but we do know this. The federal government has identified 333 communities throughout the state that are designated as dental health professional shortage areas. I repeat, dental health professional shortage areas where there's a disconnect between the need amongst the population and the professionals and the services that they're able to provide. We also know that come 2014, with the full employment of the Healthcare Reform Act, that a lot of people will have at least the health coverage and the insurance part addressed. And so what does this mean? It means that California needs a comprehensive strategy to match the services and the capacity by professionals with the needs by the population, not just children, but especially its children. So I've introduced this bill to do a couple of things. First, it would reestablish the State Office of Oral Health and reinstate the State Dental Director position to provide leadership, not just from a policy standpoint, but from an ability to draw down federal dollars standpoint to improve the care and services for California families. Second, this bill would authorize a scientifically based study to assess the safety, quality, cost-effectiveness, and patient satisfaction of irreversible dental procedures performed by both traditional dental care providers as well as non-traditional providers for the purpose of informing policy decisions about the dental workforce. As part of an integrated system of care, with a dentist always at the head of that system, additional dental providers who provide basic oral health care to underserved children may have the potential to reduce the oral health disease burden in the population most in need. We're not reinventing the wheel here. We're proposing that this study, this model be done similar to what's been done in other states, including Minnesota, Washington, Kansas, Vermont, New Mexico, Ohio, and Connecticut, amongst other jurisdictions. Also, acutely aware of our current budget situation, we're suggesting that this be done with no new general fund obligation. I do believe there is leadership present in the foundation world, in the philanthropic world, and even in the industry to fund such a study and such an office. So that is our purpose of the bill, what the bill entails, and I would ask for your support and introduce those here in support of the bill.
Thank you. Witnesses in support, please.
Yes, my name is Lisa Greenshields, and I'm a registered dental hygienist in alternative practice for the state of California. I'm currently working in Twin Rivers Unified School District in a pilot project as a dental hygienist. Most of the children that I serve at this site, in fact 97% of them qualify for free lunch, so they are indeed underserved children. We know, as we just heard in California, that 71% of the students experience some sort of tooth decay and disease by the age of third grade, which is 8 years old. This number, of course, could be greatly reduced with better access to care at an earlier age. These kids, they're suffering for a number of reasons, but primarily because of their lack of access to dental care. Every day I'm faced with frustrating situations serving this population. Just in November, as an example, I had a child who became a patient of the program. He had broke his tooth on the playground in November, was told in November when his mother tried to access care that he could see the dentist in March of 2012. So through some intervention and through some support, we were able to have him access the system earlier for the treatment of his care. But this is what's happening over and over and over again. Many times, many families are told every time they go in that with the Medi-Cal system and the Medi-Cal dentists and the provider base that it's up to 6 months before they can see a dentist. So if you intervene earlier, hopefully this care will be reduced. It's very frustrating as a public health provider to be faced with this over and over and over again. And that is why I sit here in front of you with hopes that we can change this and provide more access to the underserved and get this legislation supported and through. Thank you.
Thank you. Any other witnesses in support?
Hi, my name is Jenny Catlove. I am with the Children's Partnership. We are sponsors of SB 694. The Children's Partnership is a national but California-based child advocacy organization, and one of our goals is to make sure that all children, especially California's underserved children, get the health and dental care that they need. And this bill, so we are sponsoring this bill to ensure that all California's children get the dental care they need. We are pleased to have this. We are pleased to have the support of multiple stakeholders who care about children's issues, including the California Dental Association. And you'll see the other you'll see other lists in the analysis, other folks in the analysis. To dovetail some of the stats that the senator mentioned. About 1 million children live in those dental professional shortage areas that Senator Padilla mentioned, and that's not to mention that the access to care that other children are not getting. In addition, in terms of the Affordable Care Act, healthcare reform implementation is just around the corner. I know that we're working very hard right now to be implementing healthcare reform. We know that 1.2 million additional children will gain dental coverage. We currently don't have the providers to meet. We don't have the providers to meet our current need, the need that Senator Padilla, Lisa, and I have talked about. We certainly aren't going to have the providers to meet the needs of these additional children when healthcare reform is implemented. Addressing the dental access problem, as Senator Padilla said, requires a comprehensive approach. And a key piece of this approach is to look at our workforce and to study expanding the scope of practice of dental assistants, dental hygienists, as well as to create new dental providers that can provide much-needed routine dental care to children who are currently don't have access to care and won't have access to care in places where the care is most needed, such as in schools and in clinics. And as the senator said, this type of model has been implemented in 50 other countries and has greatly increased access to dental care for children. There are percentages in the almost 100% increase in access to dental care for kids in New Zealand and Australia. This is done with high-quality safety. There's never been a complaint around safety or quality in these other models, and it's always with the supervision of a dentist. We also need a statewide office of dental health. We need a robust statewide office of dental health. We need the leadership in California to ensure that all of California's children and other underserved populations are getting the dental care and have high-quality dental health. So with full implementation of ACA in 2014, we have no time to waste, and we urge your support of SB 694.
Thank you.
Good afternoon. Allison Barnett on behalf of the California Dental Association. CDA represents over 24,000 dentists in California, and we are here in support today of SB 694. CDA is committed to a comprehensive approach to reducing barriers to dental care in California. And so we appreciate Senator Padilla's leadership and are pleased to be working with him and the sponsor toward building a comprehensive statewide oral health infrastructure. Currently, California lacks state leadership on oral health issues, and CDA feels strongly that having a dental director at the head of a statewide office of oral health is essential to providing that leadership. And CDA feels strongly that a rigorous scientific study to assess the safety, quality, and cost effectiveness of irreversible surgical procedures performed by providers other than a dentist must be done before any changes to workforce models can be considered. And this bill seeks to address both of these issues. Again, we're committed to working with the Senator and the Children's Partnership as this bill is further developed. Thank you.
Thank you. Any other witnesses in support?
As they come forward, if I just may add, appreciate a conversation I had during the holidays with Senator Hernandez, who, as chair of the Health Committee, is asking a lot of these very sort of access questions across the board, not just core medical, not just dental, but whether it's vision, whether it's hearing, whether it's mental health or anything else. So appreciate that this is also part of a larger context and conversation.
Hello, Fran Burton from California Dental Board. We support the concept of this. We have not had a meeting. We don't meet until the end of February, at which time we will take a position on the bill. But we are very supportive of the concept of this bill. Thank you.
Thank you.
Good afternoon, Mr. Chair and members. Kathleen Hamilton with the Children's Partnership and the 100% campaign. The 100% campaign includes Children Now, Children's Defense Fund California, and the Children's Partnership. We're also in support of the challenges to meet Affordable Care Act requirements going forward on behalf of children's health care are enormous. Appreciate your support.
Thank you. Other witnesses in support?
Aaron Reed and Associates on behalf of the California Dental Hygienists Association. We support this bill in concept and like the ideas behind the bill, but right now we have a few concerns with the way the bill is written. Currently, the dental director restriction that's in the bill, we would like to see opened up. This position is an administrative position and should mirror that of other states and should be open to all qualified applicants, such as masters in dental hygiene or masters in public health. That's something that other states do that seem to have success with it. The next item would be the Workforce Study Advisory Group. Under the current language of the bill, there's no requirement that the dental director include the concerns or the advice of the advisory committee and when composing their report and recommendations. And it's critical that all the stakeholders be part of the process and that the study be non-biased and beyond the control of any one special interest. The legislation is also limited to underserved children, which is a huge need right now, but we would like to see the opportunity to take more of a comprehensive approach to healthcare policy and have it expanded. And then one last thing, in a certain section of the bill, 104751, discusses a comprehensive integrated system of dental care and mentions additional dental providers. We'd like to see that changed to be licensed, licensed dental professionals. And I wanted to thank the author and the sponsors of the bill, and we look forward to working with them.
Thank you. Any witnesses in opposition?
Hello. Hello, my name is Eric Wong. I'm a dentist that's employed by the state presently, as well as a past president of the California Academy of General Dentistry. And I'm here to present the California Academy of General Dentistry's position on SB 694. The California Academy of General Dentistry is strongly opposed to SB 694 as it is presently written. CAGD recognizes the problem of early childhood dental decay in California and joins with Senator Padilla, the California Dental Association, and the Children's Partnership in wanting to develop solutions to this problem. SB 694 is troubling to CAGD because it has two distinct elements: a call for a state dental director that we support, and a call to create a new dental workforce position, which we strongly oppose. CAGD opposes a process to create a new dental provider, a non-dentist, a person with little, if any, college education, a person with perhaps only 2 years of training, and will be allowed to perform surgical and irreversible procedures such as tooth extractions and drilling on teeth on the most vulnerable persons in our society, our children. The solution we suggest is a dental residency program such as used in New York and Rhode Island. A residency program would allow the placement of the dentists, the most capable and appropriate people there are to treat dental decay and provide dental care for the most needy of Californians in the places where they are needed. California has more dentists per population than any other state. California graduates over 600 new dentists every year. If only half of these graduates participated in residencies that are placed in underserved areas, you very quickly would have the right people providing the highest quality of care in the places where they are most needed. These programs would also allow expanded use of the existing workforce positions that are developed specifically to provide care in public health settings, such as the registered dental hygienist in alternative practice and registered dental assistants in expanded functions. We applaud the effort to provide dental care for the 1.2 million children who are not receiving dental care now and who will obtain dental benefits under the Affordable Care Act. Thank you for your time and consideration on this matter.
Thank you. Any other witnesses in opposition? Question?
I have a question. I didn't get the letter, and I'm sorry, I was preoccupied. What was your name again, and what group do you represent?
I'm Eric Wong, and I am representing the California Academy of General Dentistry.
Do we have a opposed letter from them at all? Okay.
I do have
He's got the letter.
A written copy here to save for your files and records.
I'd like to just follow up with some of the comments you made with regard to the residency programs in underserved areas. And I agree. Explain to me how your residency programs are set up. Isn't there federal funding attached to them?
Well, the residency programs some of them would come from private dental schools, and some are, of course, associated with the UC system. That's where our dental.
But I guess my question is, though, the residency programs, isn't there federal dollars attached to that? Wouldn't you also, through Medicare as well, because all residency programs are funded that way, so you'd have to get, obviously, not that I'm opposed, I think that's a great idea, but how do you assure that an individual who's going to do a residency program in a rural community or an inner city is going to stay there? I mean, there's no guarantee that they're going to stay there. So how would you address that concern?
I would believe that the present models that are in place right now have that same problem that you've just cited. Where
other than increasing the number of dentists, we can do one of two things. You can either tenfold the number of dentists that are going into dental school, because there's still going to be a workforce shortage, period. Because as 2014 looms over very soon, you're going to have more people that are going to require more services, and then there's fewer providers that go to the most neediest areas, which is the rural and the inner city. So even though you have a residency program there, you're not increasing the workforce, and how are you going to guarantee that they're going to stay there? That's my question.
I don't think there is a guarantee they would stay there.
Okay, so then we're still not solving the problem. I still think we're going to have a workforce shortage.
I think there's still a study out there to address that right now. I think it's a position of the California Academy of General Dentistry that we don't believe there's such a workforce shortage right now. That's our belief. And we want to work with the present model currently in place with the providers that are currently in place without structuring new workforce categories to address our shortages. We believe that we have the workforce in place to handle that. That's our belief.
So you don't believe there's a workforce shortage for healthcare providers in the state of California?
Not for dentistry.
In rural communities?
I believe there's a funding problem personally, but I don't think there's a shortage of needing people there. It's just common economics. If you want me to go work in the high desert, I might choose to do so, but most people don't want to work in the high desert because there's not enough patients and enough of job security for myself to go there. So I believe it's a monetary problem and not necessarily a workforce problem. That's my personal belief.
Okay, thank you.
Thank you. Thank you for the opportunity.
Senator McLeod.
Senator Padilla, a couple of the objections were that the person that you would that would put in the Office of Oral Health Director, that they would not have the qualifications that they would feel that would be for dentistry. Is there some way that you're going to change that you would ask that they be someone that actually is in the field as opposed to an MBA with something? He's got an MBA, but it's not in the field.
Actually, I interpreted the concern that was raised in reverse. The way the bill is written, it requires that the dental director position be filled by someone who is a dentist. And it is other folks in the dental arena who may not quite be dentists, but maybe elsewhere in the dental field, that they should be eligible for the director position as well. So that's something that's been raised before. We'll continue to have the conversation. But for now, I err on the side of being more selective as opposed to less selective.
I had a question for Dr. Wong. Did he? Yeah. I think you're misinterpreting the second part of this bill. This is a study. It's not dictating what the model will be. It's a study, and dentists will then have the opportunity to weigh in on that study at some point. So, are you a member of California Dental Association?
I am.
So, the House of Delegates passed this resolution to support this concept by 80% of the members of the House of Delegates, so that there will be a study that will come back, and it's uncertain if it's coming to the legislature or the dental board, but certainly the California dentists will have the opportunity to weigh in on what that model looks like. And I mean, I'm not dismissing the fact that it could be some kind of fifth-year pathway that dental students are involved in that process. The problem is we do have underserved areas in the state of California, and they're not only rural areas, they're in large metropolitan areas as well. So I think this is a study, so let's look at it in that context and then make our decisions on that model when we see what the study says.
Thank you.
Thank you.
Walters?
First of all, I support the concept of this. I have a couple questions, though. One of my biggest concerns is the fiscal side of it. My understanding is that you are looking for private donations and federal funding, and it's no money out of the general fund.
That is correct.
And I also, is there some sort of amendments that you are going to be putting in Health Committee that you're going to be taking in Health Committee after this committee?
Yes. Again, this is the first step in multiple policy committees in each of the houses. So it's a little bit of a work in progress here.
Right. But my question is it language that's going to tighten up the fiscal side of it?
Yes.
Okay.
Yes. Again, our intent, and I'll say it till I'm blue in the face, no impact to the general fund.
Right. Right.
Is where we're going.
And I know that we say that, and that often is true, and then eventually it does have an impact down the road with general fund for circumstances that are unforeseen sometimes.
Yeah. And I'm happy to share with you the Health Committee analysis with the specific language to achieve that, if you haven't seen it.
Well, here's what I'm going to do, because I'd like to have the amendments in place before I vote on it. I'm going to lay off of it in this committee. It's going to come to appropriations, my understanding is.
Correct.
After I see the amendments and after they're put into the bill, when it gets to appropriations, I will then support it.
Okay. Thank you.
Any other discussion? Well, I think this certainly, first of all, I just want to applaud the sponsor and author. I think it does address an issue of providing dental services in underserved areas. I think this is notable because it is a study, and a study hopefully that will not cost the general fund any expenses. But I think it also puts us in a position to get some of the money that we've been leaving on the table, particularly with the establishment of a director. Correct. So I'm pleased to support it. I'd like to be added as a co-author. I'll entertain a motion to move forward.
Do pass.
Do pass to appropriate as. I'm sorry. Goes to rules.
I did want to make a comment on the dental director. It's been more than a decade since we've had a dental director. The last dental director was during the Gray Davis administration when Jack Dillenberg was the dental director, and he left that position to become one of the deans at the University of Arizona Dental School. And I think if you look at, and to my colleagues that are concerned about the funding situation, I think that you look at states that have dental directors, they're able to bring down considerable dollars from foundations and from the federal government to address those issues on how we best solve the problem of oral health issues. And so I think that's a very important aspect of this, and I share with Senator Padilla the fact that somebody's calling you, Alex, there to tell you that he got some money for this bill. No, so that this will work, and it's a good proposal, and I'm glad to support it.
Thank you.
Care to close?
Respectfully ask for your vote.
Okay. Here's a motion. Secretary, please call the roll.
Price?
Aye.
Price, aye. Emerson? Aye. Emerson, aye. Corbett? Aye. Corbett, aye. Correa? Aye. Correa, aye. Hernandez? Aye. Hernandez, aye. Negrete McLeod? Aye. Negrete McLeod, aye. Vargas?
Aye.
Vargas, aye. Walters? Wyland? So that's 3, 7.
Okay. 7-0, that is out. Thank you
very much.
Senator Walters, Senate Bill 692.
Thank you, Mr. Chairman. I again present the committee Senate Bill 692. When SB 692 was originally heard in committee, the bill simply gave all engineering disciplines the same status. This language did not affect the opposition, but the committee approved it nonetheless. To ensure that the committee's consideration given and my effort as author of the bill would be effective, I requested the opinion from the Legislative Council, which all of you have by now read. The opinion concluded that the Professional Engineers Act gives licensed civil engineers a complete monopoly over any professional services to develop fixed works. The exemptions are few and minor, do not recognize the necessary contributions from other engineering disciplines and professions. SB 692, as it was approved by committee, would have been ineffective as a result. SB 692, as it is now amended, will provide California with a PE Act that is consistent with the rest of the nation, as well as bringing it in line with the current practice. Now the law can no longer be ignored. Our state, and more importantly our citizens, must be protected by allowing the use of all competent expertise to address the complex issues that our society faces, especially with new high-tech and green-tech engineering solutions that are required to meet the needs of California today. And I have several people with me to testify.
Okay. Witnesses in support, please. Identify yourself.
Andrea Fox from the California Farm Bureau. Glad to be back again. See you all again. The Farm Bureau sponsored SB 692 because of the ever-increasing regulations and requirements that have been placed upon the agricultural community to meet the needs, to provide what is needed in producing the abundant food that we produce, and also to protect the environment. Too often, the arbitrary requirement that a civil engineer must be involved, even if not necessary, has caused increased costs and delays. The Farm Bureau appreciates Ms. Walters' open access to the vital expertise needed by agriculture. She has been most helpful in requesting a legal opinion from the Legislative Council to help us better understand the law, to see how it needs to be reformed. The opinion makes it clear the licensed civil engineers have a monopoly when we develop fixed works for agriculture. The law is even more restrictive than we realized before now. If biologists, chemists, agricultural engineers, and other experts are used in food processing, irrigation, and waste discharges, just a few examples, we now know that they must be licensed as civil engineers, and they also must be competent. They cannot just sign on the work of others. SB 692 will allow our industry to have access to the expertise we need to protect the public. It is difficult, if not impossible, to see how we can meet the public's expectations unless the law is reformed. Thank you.
Thank you. Any other witnesses?
Good afternoon. My name is Enrique Lavernia, and I currently have the privilege of serving as the Dean of Engineering at UC Davis, and I'm here representing 7 engineering deans from the UC system, as well as a number of other Cal State deans and some private school deans who support SB 692. And we support 692 for 3 reasons. First, because it recognizes the value and importance of all engineering disciplines and makes competence the standard under which services are delivered, a practice which I might note is consistent with that in other states. Number 2, 692 will ensure that the people in this state will benefit from the depth and breadth of the engineering expertise in this state. And number 3, at a time when we are struggling in academia to graduate more and more engineers, failure of passage of 692 will introduce unnecessary questions as to the future of current and future engineering students in this state. Thank you.
Thank you. Other witnesses?
Good afternoon, Mr. Chair and members of the committee. Deborah Matos for the Independent Oil Marketers Association. We have been supportive of this bill since last year. We're also supportive in its amended form. We're very pleased to see the new Ledge Council opinion. We represent small businesses in the state. We hire chemical engineers, environmental engineers, all sorts of engineers. And actually, I have to tell you, at the Ledge meeting, it was a civil engineer within the membership who stood up and said, we must support this bill. This is unfair. I have to hire these people to tell me I don't know how to do some of this cleanup work that's done throughout the state. He said this is fair and we need to support this important legislation.
Thank you. Other witnesses in support? Any witnesses in opposition? Please come forward.
Thank you, Mr. Chair and members. Steve Baker with Aaron Reed and Associates, representing the professional engineers in California government. We were here before this committee last year and opposed the bill. We remain opposed. The amendments don't do anything to help remove our opposition. If anything, we think that the bill is going in the wrong direction with providing the overlap of all of the engineering disciplines. The reason for professional licensure in any category is to protect the public health and safety. We don't see how allowing overlap between all of the professions and allow those professions to self-certify their competence protects the public safety. And for those reasons, we remain opposed to the bill and would ask for a no vote.
Mr. Chair, members, Mark Smith on behalf of the American Council of Engineering Companies of California. For the reasons previously stated, we also oppose this bill. Thank you.
Happy New Year, Mr. Chairman, members. Richard Markison, representing the American Society of Civil Engineers. 17,000 or so civil engineers in public and private practice were also opposed. And unfortunately, I think that much of the testimony has suggested that the current Professional Engineers Act grants a monopoly to civil engineers. We would look at it from a slightly different perspective. And we think that the current PE Act protects the public from the unwarranted or unprepared engineer from practicing civil engineer, which this bill would now permit them to do. A number of the Title Act engineers who would be elevated to a Practice Act engineer and by the bill be allowed to practice civil engineering have actually never tested and demonstrated their competency to the Engineers Board. When the Title Acts were created, a number of practitioners were grandfathered into their title and never tested. That simply does not exist for civil, electrical, and mechanical engineers. This is unwarranted. We actually think that the public would be put at risk from this. We're opposed and urge you to vote no.
Thank you. Any other comments in opposition? Members, any comments? Senator Corbett?
I have a question. Could the person from the civil engineers please come back for just a moment? And anybody else who might want to answer the question, that's fine. I struggled with this bill last year as well, and I'm still struggling with this bill. I'm not an engineer. I've sat on the Business and Professions Committee in both houses, so I've had my share of engineering training by way of the B&P committees. And I'm having a hard time understanding, obviously in some cases, and I'm not saying this as a practitioner, obviously there are people who are trained in engineering in the various different fields that are obviously highly competent, able to make decisions, sign off on projects, have that experience and expertise. But I'm having a hard time understanding if that is true across the board in each individual engineering, specialty. And I'm also having a hard time understanding this comment that civil engineers perhaps maybe aren't needed to sign off because these people have their experience and their expertise and it's just an added cost. Obviously, at some point when the law was created to allow that civil engineers are involved in this process in a sign-off or whatever way we want to characterize it, it was done for a good reason. And I'm having a hard time really understanding whether it is time to abandon the way things have been done, because the expertise and the training and the education of these specialties has evolved over time, and maybe it is needed now or it isn't needed anymore. for me, there's just so many moving parts. I'm having a hard time really determining what is the best thing to do. And I guess my broader question would be, why isn't the board addressing, I mean, maybe they have tried over the years, and obviously they probably have, but why isn't the board more involved in this issue that you actually raised, that there are individual specialties that, you know, have been certified appropriately or not certified appropriately? Why isn't the board more involved in sort of meting that all out?
Well, I can't speak to why the board's not involved today. I think that probably part of it is, and it was covered in your analysis, is that there's been a 20-year history of struggling over this, and the board has been more involved in the past, and ultimately we're still in this committee debating the same issue that we have been for almost 20 years. Getting to your other question, though, about the regulation of the practice in California, there are two distinct recognitions for regulating engineering practice in California, and one is the Practice Acts, which are the three recognized civil, electrical, and mechanical, and then there are the 9 Title Acts. The Practice Act engineers are regulated both for their use of their title, but also the practice of engineering. And so the statute and the regulations that the board have adopted cover both the use of their name as a civil or electrical mechanical engineer, but also define what those practice activities may include. Over the years, because of their own organizational desire, many of the Title Act engineers who are supporting this measure today sought to have a legislative endorsement of, I'm an engineer and I deserve to have some regulation. But unfortunately, where we stand today is those engineers' practice has never been regulated. Only the use of the title has been regulated. And so while there are the 9 Title Act engineers and 2, to make things even more confusing, 2 title authorities, the 9 Title Act engineers don't have a regulated practice. They are regulated over their use of the title, fire protection, traffic, etc. Many of them are jointly licensed. Many of them have a civil and or mechanical or electrical Practice Act engineer license in addition to the Title Act. But the board is constrained, and the only disciplinary action that may be taken against a Title Act engineer, if there is malpractice, is to remove their authority to use the title. There's nothing to stop someone from engaging in what is commonly referred to as agricultural or any of the 9 Title Acts design activities. Simply, they are proscribed from using that name as a Title Act engineer in any kind of commerce. It's a very confusing thing, and I think that many of the practitioners and the opponents to the bill would not have embraced this licensure method for the state of California. And I think the real conundrum is, how do we move from this rather confusing Practice Title Act situation to a more logical licensure scheme?
Don Reisner, representing the California Legislative Council of Professional Engineers. In 2005, the board sponsored legislation that's basically what we have in 692. They did so after a $450,000 study that demonstrated there's no reason that all engineering disciplines should not be treated the same at the same level of respect, which is the law in every other state. Mr. Markison was involved in that study and is aware that all this took place. And as far as discipline of Title Act engineers, any licensed engineer pursuant to Rule 415 by the board is required to be competent whenever they provide any service. And that provision is codified in 692 to make sure there's no misunderstanding. If you're not competent and you do something as a licensed engineer, then you've got a problem. So as far as the respect that should be given to the various disciplines, Dean Lavernia should be able to answer those questions.
Larry Emerson.
Yeah, Dean Lavernia,
I'm sorry, did you want to respond?
He'll answer all questions.
The question I had is, there's been some discussion about that Deans and the Title Act engineers are not fully tested for whatever they do their engineering on. Is that a true statement? Or
Well, so the professional engineering degree is a very basic entry-level requirement. Once you pass that exam, the definition of competence means that you deliver an engineering design that's within your expertise and that will function as such. Failure to do so means that you're probably going to end up losing your job.
But they are tested on their expertise, on their training and expertise.
Yes.
And do you envision that they in any way would act or could act as a civil engineer?
No, they would only be able to act under their own competence.
Their own competence. Okay, thank you.
Any other discussion? Well, I know this has been a discussion we've been having for the past 20 years, as I understand, and I'm not convinced that we've got it clarified now. I'm not going to be able to support it as it's presented if it is not successful, though I think we can come back for reconsideration. What's the...
Yes, we can.
Okay.
Urgency clause.
All right. Is there a motion?
I'll move the bill.
Madam Secretary, please call the roll.
Price, Emerson.
Aye.
Emerson, I. Corbett, Correa, Hernandez, Negrete McLeod, Vargas, Walters, Wyland. One aye.
Okay, it's one aye.
I think she may have voted for her own.
Two
I'm
ayes.
sorry, I
Two
didn't hear
ayes.
you. I didn't hear you. Two ayes.
Two ayes have it.
I didn't hear her.
That's encouraging.
She was vacillating.
That's progress.
I'd like to ask for reconsideration, and I know it's an urgency bill, so we would have to do a special hearing.
Yes, we'll arrange that.
Thank you.
Thank you. Okay,
Now you're up, son.
I'm up.
She wasn't sure whether it was.
I didn't hear her. I wasn't even thinking about it.
She didn't say
Thank you, Mr. Chairman. Members, this measure is identical to language we heard in the Sunset Bill for the Board of Registered Nursing from last year, that infamous bill from last year. I'd like to begin, however, by offering two authors' amendments to the bill. The first will correct an error by Legislative Counsel which left out a provision which authorizes the Board of Registered Nursing to issue a cease and desist order to a school that has not been approved by the Board, and to inform the Attorney General of a school which continues to operate illegally. The second amendment will delete a provision from the bill which requires accreditation of nursing programs. We need to continue to work with the board and the nurses on this provision. With these two amendments, this bill still provides that the nursing board shall be the only agency responsible for approving schools of nursing and to receive an appropriate fee for the work and effort they put into approving these schools. The Board of Registered Nursing was originally the sponsor of this language, and hopefully, once restored, it will be again. I respectfully ask for your aye vote on this measure.
Witnesses in support.
Tricia Hunter, American Nurses Association, California, strongly in support of the bill and hoping we can get the accreditation piece back in there as well. We appreciate all the work the author did on this last year and believe strongly that this bill needs to be passed.
Any other witnesses in support? Witnesses in opposition? Questions by the committee? Senator McLeod.
Mr. Price, what if the board takes too long to accredit something? You know, if there's some kind of a lengthy thing, because I know in the past that was a problem.
Right. I'm not sure what the remedy is, but it's something we can address.
Have you heard from the administration on this particular movement here?
Yes, they are supportive of this approach.
Okay. All right. The bill has been moved. Please call the roll.
Price?
Aye.
Price, aye. Emerson?
Aye.
Emerson, aye. Corbett? Corbett, aye. Correa?
Aye.
Correa, aye. Hernandez? Hernandez, aye. Negrete McLeod? Negrete McLeod, aye. Vargas?
Aye.
Vargas, aye. Walters?
44.
Wyland?
Yeah, he pulled that. So this is his last.
7-0.
Item number 7, Senate Bill 875 with
Item number 7.
Yeah, number 7, real estate. The other's been pulled.
Thank you, Mr. Chairman. Members, the Department of Real Estate, Senate Bill 875 gives the Department of Real Estate additional tools to use when denying a license and deletes an obsolete provision dealing with conditional licenses. This bill is intended to enhance their enforcement program, streamline the licensing process, and to reduce the administrative costs. Specifically, SB 875 allows the Department of Real Estate to issue a written notice of denial instead of a statement of issues when denying a real estate license. It does not shortcut the applicant's right to a hearing or violate the Administrative Procedures Act. All boards in the Department of Consumer Affairs have had this same ability for a number of years. And the bill just simply gives the Department of Real Estate the same ability. In addition, 875 strikes out an obsolete provision dealing with conditional licenses. The Department of Real Estate no longer issues conditional licenses. Therefore, this provision is irrelevant. I respectfully ask for your aye vote.
Witnesses in support? Witnesses in opposition? Questions by the committee?
I'll move the bill.
The bill has been moved. Secretary, please call the roll.
Price?
Aye.
Price, aye. Emerson?
Aye.
Emerson, aye. Corbett? Corbett, aye. Correa?
Aye.
Correa, aye. Hernandez? Hernandez, aye. Negrete McLeod? Negrete McLeod, aye. Vargas?
Aye.
Vargas, aye. Walters? Walters, aye. Wyland? Passes out 8-0.
Thank you.
One other item,
We have a
consent calendar.
Yeah, consent
Consent
calendar. SB 632.
Please, my friends from the Board of Behavioral Sciences, yeah, we all want this on consent. This would be good for the people of the state of California. So, entertain a motion. So move. Please call the roll.
Price?
Aye.
Price, aye. Emerson? Emerson, aye. Corbett? Corbett, aye. Correa?
Aye.
Correa, aye. Hernandez? Hernandez, aye. Negrete McLeod? Negrete McLeod, aye. Vargas?
Aye.
Vargas, aye. Walters? Walters, aye. Wyland? 8-0. Passes out.
All right, ladies and gentlemen, once again, the people's business has been done.
Hold on. We want to get that.
Almost.
Item number 2.
Item number 2. Secretary, call the roll.
Correa?
Aye.
Correa, aye. Hernandez? Wyland? So it passes out 7-0.
Okay, that passes out 7-0.
And
Item
number 1, SB 122. Walters? Wyland? 7-0. Right now,
We did,
122.
122.
Item 1? No.
the previous. You want the previous bill?
Previous one? On 352? Yeah. Oh, I didn't hear you vote, sir. I'm sorry. Hernandez, no on SB 352? Oh, that's not... Never mind.
That's why she didn't
Not
hear you.
voting.
It was a silent vote.
My mistake.
Week back, we need to have some training.
That bill passes out 7-0.
That bill's out 7-0.
We're done.
If there's no further business, this meeting is adjourned.